Welcome to part 2 of our sciatic pain video series, where we're helping you not only get out of sciatic pain, but learn what you need to do to prevent this sciatic pain from coming back. So we're into part 2. If you missed part 1, be sure that you watch that first before trying this. In part 1, we really focused on fixing any sort of, again, they're called antalgic shifts, where again, if you're shifted to one way. Today, what we're going to focus on, or in this video, what we're going to focus on is finding, it's called your directional preference. So if you remember from part 1, what a lot of sciatic pain is actually a result of, they're called disc herniations, which are similar to like squishing a jelly donut. And when you squish a jelly donut and the jelly pops out one side, that jelly is going to put some pressure on some nerves, which is going to send that shooting pain down your leg. So what we want to do is learn how to pull that jelly back inside the disc, and that's what we're going to do in this video with what is called directional preference. So again, in part 1, we had mentioned getting a couple clues from the history. So things like, is your pain better sitting down? Is your pain better standing up? What movements seem to aggravate, especially that leg pain? And we're going to use that just as clues to figure out the directional preference. So the third step is going to be, we're just going to do one range of motion in a few different directions. And again, all we're trying to do is just get a baseline, looking for if anything obvious pops out, looking for any catches, looking for if we get blocked anywhere. We're going to start just doing one rep, and I'll go through the movements here. We're going to do, first and foremost, just a standing flexion. So I'm just going to be standing, and then all we're going to do is round forward. Now I should make clear that in what we're looking for is especially a reproduction of leg pain. So again, as we go through the movements, a lot of them are going to increase that pain in the low back, but I want you to be very clear what we're looking for is, one, is it reducing the intensity of the leg pain, but more importantly, is that leg pain coming up the leg? It's called centralizing. So if I have pain in my calf area, if when I get into a certain movement, does that make the pain come up into the hamstring? If so, that is a very good sign that our body likes that movement. But if we get into a certain position and it does the opposite, where again the pain goes further down into my toes, that is indicative that our body doesn't like that movement. But again, I just wanted to be clear that the pain in the low back can sometimes increase with these movements, but as long as the pain is coming up the leg, that would be okay. So again, I'll get back into the movement. So first one was the forward flexion. So again, just kind of rounding the back there. Again, we're just starting off with one repetition of each. Next is going to be standing extension. So we're just going to hands on the hips, and we're going to press back and extend back. Again, just looking for catches, any obvious directional preference, so anything down the leg. Next is just going to be side glide. So we're going to take one hand on the hip, one hand on our kind of upper rib cage here, and we're going to push one direction, and then we're going to push the other direction. Again, we're just doing one rep. We're looking for any patterns, any catches, any obvious shooting pain down the leg. The last two we're going to do will be on the ground. I've got a little bench here, but we're going to do on our back, and we're just going to pull our knees to our chest. See how that feels. And then we're going to roll onto our stomach, and we're going to do a press up. So getting our spine into extension. So that's step 3. Again, just looking for just general clues, catches, blocks, if anything obvious pops out, where if we bend forward, there's an obvious pain down the leg. Now we're going to spend a little bit of time into each movement. So what we're going to do, it's actually going to be 10 repetitions. And what we really want to make sure is that we're getting into end range. So usually what I'll instruct people to do as they go through the movements is, as we bend forward, you really want to go further. You really want to sink into that end range. So a lot of people will go to their toes. I'll say further. I really want them to bend into that end range. They're going to hold it for a second and then come back up. And they're going to do 10 rounds of that. And again, what we're looking for is that pain down the leg. Is the pain getting better, coming closer up into the low back, or is it getting worse? Is it shooting pain down the leg? If it's low back pain, is it getting smaller in our low back? Again, if we have like a big circle of back pain, is it shrinking or getting smaller in our low back? Those are other things that we want to pay attention to, but we're going to do those same movements. So I just showed you flexion. You're going to do 10 rounds of that. Again, really making sure that you get into end range. Can't stress that enough. Next is, again, that extension. So we're going to do hands on the hips, and we're going to press back. And again, further, further, further. You really want to get into as much extension. Again, sometimes this will increase the pain in the low back, but what we really want to pay attention to is that pain down the leg. If I extend back, okay, a little bit more pain in the low back, but that pain is coming from my calf into my hamstring, which would be a good sign. Good. So you're going to do 10 repetitions there, and then we're going to do 10 repetitions of the knees to chest. So same thing. We're going to roll on our back. We're going to grab our knees, and we're really going to pull. So again, it's called further, further. When I'm in a room with the patient, I'll actually put a little bit of overpressure down on their knees to make sure we really get to that end range. Hold it for a second, and then you're going to come back down, and then you're going to pull your knees back up. So you're going to do 10 repetitions there. And then the last one, what we're going to do is that extension. So we're on the bench. Same thing. Further, further, letting those hips drop, really getting extension in the low back, and paying attention to any sort of leg symptoms that we're experiencing. So that is going to be the end of our part 2 of this sciatic pain series. And so ideally by the end of this, we have a good idea of what direction your body likes, what direction pulls that pain up the leg, and that's going to be incorporated into your homework. So again, just so you can imagine it, we're trying to pull that jelly back under the disc, and sometimes that's going to take time, so we just add this into the homework. It's something that you would do about 10 repetitions every 1 to 2 hours, just really trying to pull that jelly back in. So that's all we have it for part 2. Again, if you didn't watch part 1, make sure you watch that, and then make sure you watch part 3. Again, my name is Dr. Carl Baird, owner of Evolve Performance Healthcare here in Portland, Oregon. If you have questions about your specific case and wanted to hop on a free phone call, we are happy to discuss what's been going on and see if we'd be able to help. You'll find the link down below. Thanks again for watching, and we'll talk to you soon.